The Black Death wasn't just one of the deadliest pandemics in human history. It was also the moment medicine completely lost its grip on reality. Imagine being sick with a disease that's killing entire towns, and your doctor shows up in a leather cloak wearing a bird mask and rubbing a dead pigeon on your chest. This isn't horror fiction. This was medieval healthcare. The plague first arrived in Europe in 1347, likely via trade ships carrying rats and infected fleas. And when it hit hard. People developed giant, painful swellings called buboes under their arms, on their necks, and in their groins. They vomited blood, their skin turned black, and death could come within just 3 days. No one was prepared. Science, as we know it, didn't really exist yet. There were no germs, no antibiotics, no understanding of how disease spread. So people turned to what they did understand: superstition, religion, and centuries-old guesswork. Doctors, if you could even call them that, believed that bad air or miasma was the cause. They thought the plague spread through foul smells in the wind, so they started wearing long cloaks and terrifying beaked masks filled with sweet-smelling herbs like lavender, mint, and rose petals. The mask's nose acted like an ancient air filter, except it did absolutely nothing. They weren't just useless, and they were dangerous. Treatments were beyond bizarre. Patients were told to rub chopped onions, crushed flowers, or vinegar on their sores. If that didn't work, some were instructed to drink molten gold or mercury. Others were told to bathe in urine, sometimes their own. Bloodletting was common. Doctors would slice open veins, hoping to balance the humors. In reality, they were weakening already dying people even further. And then came the pigeon treatment. Yes, this was real. Physicians would take a freshly killed pigeon, still warm, and press it to a patient's swollen lymph nodes. The belief that the bird would draw out the sickness and absorb the infection. When the bird died, they'd throw it away and grab another one. Repeat as needed. In some cases, they'd even apply frog paste or smear human feces on the sores. But medieval medicine wasn't just weird, it was brutal. Some towns would literally wall up infected families in their homes, sealing them in alive. Quarantines lasted for weeks or months. People painted red crosses on their doors with the words, "Lord have mercy." Mass graves filled entire fields. Bodies were dumped by the hundreds, covered in lime and forgotten. Amid the chaos, a few groups tried more creative cures. Some believed music could drive the plague away. Others believed it was punishment for sin, so they walked from town to town whipping themselves in public. Bloody processions of flagellants trying to earn God's forgiveness. But here's the darkest part: most of it didn't help. If anything, these treatments spread the disease further. Doctors carried it from house to house. Religious mobs stirred panic. And cures involving blood and body fluids only increased contact with infected materials. The plague was a disaster, but in a twisted way it forced medicine to evolve. By the end of it, some people began to doubt superstition. They saw that the disease spread more in dirty, overcrowded places and less in isolated, clean areas. It planted the earliest seeds of what would become modern epidemiology. Still, for the people who lived through it, medieval medicine wasn't healing. It was a performance, a desperate, chaotic ritual to make sense of something they couldn't understand. So next time you're annoyed waiting for a prescription, just be glad your doctor isn't reaching for a dead pigeon.